Columbia, the station you count on for local news. This is WIS News 10's 7 o'clock report.
Another big issue facing the candidates this election is health care. Today, families affected by chronic disease and representatives of health care providers held a forum at the Clarion Townhouse. They called on candidates to propose specific solutions to make health care affordable for all Americans.
And being uninsured myself at the end of this year, that's very frightening. And with health care costs like they are, it's very hard for me. So I'd like to see the government help those like me in my situation have affordable health care or something to where I can be insured.
The statement to candidates was signed by the leaders of nearly 50 health care groups, including the American Heart Association, the American Cancer Society, and the Autism Society of America.
From the ABC Columbia studio at Main and Gervais, this is ABC Columbia News at 6.
Families of the more than 50,000 South Carolinians diagnosed with Alzheimer's want better health care. They voiced their opinion today. The disease affects the central nervous system and eventually causes memory loss and changes in behavior. Today, families of those directly affected by the disease gather to talk with healthcare leaders. They're trying to drum up support to provide all Americans access to long-term care.
There needs to be exceptions to certain diseases, I think. This is something you can't plan for. You don't know when you're going to get it. She has early onset, which is highly unusual. And I just think the government needs to step back, look at this thing and say, hey, we've got to help these people.
Experts say 47 million Americans do not have health insurance.
This is Watch Fox News at 10.
And just ahead on Watch Fox News at 10, putting the face on a national crisis. Chronic disease sufferers and the battles they can face with insurance companies. One woman's story in Health Watch. For chronic disease sufferers, getting and keeping health insurance can be a problem. The National Health Council and the Alzheimer's Association are joining forces to raise awareness about this issue by putting a face on the problem. Tonight, the story of an Irma woman in her own battle for her life. This is the result of years of treatment for a rare blood cancer. B.J. Wellborn has chronic myelogenous leukemia, or CML. She's now in remission, but says the journey getting there has been hard.
The trip was very emotional, and it was very expensive.
Doctors diagnosed Wellborn in 2002. Since then, her life has been full of battles with the insurance company, regular oncologist visits, and prescriptions, all of which totals in the hundreds of thousands of dollars.
I'm a very expensive case. I drain profit margins, and it's not a drug I can shop around for. It's still patented. And it's not one I can go to a drugstore and get, like an antibiotic sitting on a shelf.
Wellborn takes Gleevec, a drug that costs $100 a day. Her husband's insurance covers her, and each year doctors review her case. They determine if she needs the drug and if the insurance company should pay. It's a what-if game she calls emotionally draining.
My fear, Ariel, is that one day the board will say, we think you've been in remission long enough, you're cured. Or worse, that my blood test one day will show my cancer is back, and I'll need a more expensive, more experimental drug that the insurance company might not feel comfortable covering.
There is no cure for CML. Wellborn will take medication for the rest of her life.
The scariest thing I face now is the what-if game. What if my blood test showed the cancer's back and I need a different kind of more expensive drug, or if something where my insurance company would just deny me the drug, or something would happen to my husband and his insurance.
Wellborn has to go through the insurance review process every year. The National Health Council says chronic disease, death, and disability in South Carolina. The group would like to see an effective and affordable health care plan for everyone, including chronic disease patients.